One of the most concerning things that we see as pediatric surgeons and as ED physicians are button batteries. Button batteries are found in some common toys. They're actually found even in musical greeting cards, remote controls, hearing aids, places that you wouldn't think of. When we see these injuries, the extent of damage created by a button battery is quite scary. They're actually quite deadly if left in place after a child perhaps swallows them or gets them down into their airway. When a child ingests or inhales a button battery, there's quite extensive damage left in the tract of the battery. Usually the battery gets lodged in a specific location. The child will manifest some symptoms, usually coughing or sputtering, and they might present with some abdominal pain or neck pain, and that leads a parent to bring them to the emergency department. Within seconds of a battery touching tissue internally, it starts the course of damage. So it's really important for parents to not only keep these batteries out of reach of children and to be aware of where they can exist, but also that if a child is to swallow or inhale one of these, that they act appropriately and rather quickly, because every second counts. It's not just button batteries that, if swallowed or inhaled, can cause a lot of damage. One of the other common items that we see are these magnets. And these exist in a lot of common children toys. They're actually colored and look like little candies, so they're kind of tempting for children to want to eat. These magnets have much more strength than a normal magnet you would find on your refrigerator. The problem is when children ingest these and they swallow them and they go down into their intestines and their stomach, they actually will stick together, and they might actually stick intestine loops or parts of the internal organs together. Eventually, they can actually make holes in those organs, or they can cause obstructions where a child can no longer poop or pass gas, have regular farts, and they might require a major abdominal surgery to remove these. So water beads, which are sometimes commonly found in air fresheners, or sometimes people put them in the bottom of their plant bases to make them look more appealing or pretty. They have a lot of nice colors. What happens with them is that when children swallow them, and a lot of times they're appealing to be swallowed because they look like sprinkles, they're very colorful and they're very tiny. The problem is that once they get swallowed and once water hits them, they grow. And they continuously grow. Some of them actually can get as large as this, which is quite impressive. If that was to grow inside of you, specifically within the intestines, the risk is a complete obstruction, very similar to what we see with the magnets, or a perforation, which means a hole in the intestines. Either of those would require a major operation to have these beads removed. They're commonly referred to as orbeez, or just called water beads. So we don't always know that children swallow substances. A lot of times we get a report from the family, I think they swallowed it, they may have swallowed it. However, if it's a witnessed ingestion, if a family knows that their child has swallowed, let's say, a button battery, it's really important to go online. There's the Button Battery Task Force. They actually have an algorithm, and they can tell you exactly what to do en route to the hospital and what to do before you arrive at the hospital. As for corrosive substances or other things, you can always call poison control. They'll tell you exactly what to do on your route to the hospital in order to help mitigate or get rid of some of the more damaging factors, at least prevent some more damage on the way. Children may not always know or want to tell a parent what they swallowed. They might not know it was dangerous. They might have thought that they just took a candy. It's really up to either a witnessed event or a parent's suspicion. Once there's any question, I cannot tell you enough the importance of making sure that you get your child checked by a medical professional. It's better to be checked and to find out that no, they actually didn't swallow something, than to sit and wait on it, because time is really important in any of these injuries. And as I said before, these are actually medical emergencies if left untreated.